Hello, everyone. I'm Joseph Aldos Hunter, and I'm Nava's Portfolio Senior Director for State and Local Programs, where I lead a team of program managers and directors to oversee all delivery across multiple states and benefit areas, which include Medicaid, paid family medical leave, unemployment insurance, early childhood education, and much more. Before I get started, I wanted to share that uh, late last year, Nava began working with multiple states to help understand HR requirements for SNAP payment error rates. And as many of you know, with the recent cost sharing changes introduced by HR 1 legislation, states must reduce their SNAP payment error rate, or PER or PER, as you'll hear throughout this presentation, to below 6% or be required to incur cost sharing. So falling short of that threshold exposes the state to substantial financial penalties and increased administrative burden. State partners are reporting a high level of urgency regarding the new burden the new burden created by HR 1 and the increased accountability tied to SNAP error rates, as these changes may have significant effects on how your state operates and administers the SNAP program. While speaking with several states, we've heard reports of PER between 11% and 20%, which would have an estimated cost sharing of roughly $55 million to $250 million per year. So, what Nava did is we partnered with the state in an intensive 8-week engagement, working side by side with state stakeholders. One thing to note is that the states the state that we worked with used October 1st, 2025 timeline as a strategic decision. States can use either the fiscal year 2025 or the fiscal year 2026 to benchmark their PER against the national average and estimate potential cost sharing penalties. The goal in this case, the strategic goal in this case, was to have a PER reduction plan in place by October 1st, 2025, so that the state could use the full fiscal year 26 performance period as a benchmark. So, first, a little bit about the strategy. In the first 2 weeks, Nava conducted a targeted technical research and process assessment to identify the highest impact opportunities to reduce PER. Our recommendations combine public-facing digital solutions with caseworker-focused operational improvements. In short, in 6 weeks, we rapidly built, launched capabilities, and are now live in production and already helping to lower PER. So what you're looking at here first is our first production implemented application called Intelligent Document Processing, which initially focused on income document uploads for SNAP applicants, but can easily expand to other document types. Features include image assessment that enhances SNAP applications by improving image quality and streamlining data entry. The system validates uploads in real time, it guides users to correct issues, and leverages OCR to extract information to save all content, allowing for automatic data entry. So this reduces errors, lightens workload, and accelerates application process for all applicants. Now, to date, based on that implementation of October 1st, we have seen over 200,000 documents for income that have been evaluated. We average 2,100 documents per day. There is less than 3% of the applicants abandon the document upload flow, and of the 15% of the documents being submitted, 15% need some additional attention, whether that's missing information or it is unreadable. What's really important about this is in the document, the IDP process, by giving the beneficiary feedback on what they're uploading, we see 85% of those applicants resubmit after that IDP guidance. So this is significant for the ability to reach the beneficiary at the moment and ensure the application is processed with the greatest success. So with that, the second production implementation application is called our Benefit Status Tracker, which initially focused on the limited visibility that beneficiaries have to their SNAP claim status. The state's SNAP application cannot require an authenticated account in a vendor solution, which is where beneficiaries check their status. Without that visibility, Nava was able to identify issues which led to duplicate applications and increased call center traffic. With the state's integrated eligibility system and an opportunity to impact other benefit areas, the state actually increased our scope on this status tracker to include their Medicaid, LIHEAP, and TANF. So Nava's status tracker approach was an outside the vendor solution with the integration points allowing the state more control over their data and other possible integrations with the status information. The status tracker offers near real-time updates, clear next steps and actions, and all without requiring a login. We've seen reduction in call volumes and improving the application experience across not just SNAP, but other benefit areas as well. So to date, to give some additional highlights, there's been roughly a 20% reduction in help desk inquiries about application status. We've seen more than 32,000 unique status checks that have taken place. And recently, status checks grew from implementation period by 133% and then 42% week over week, demonstrating strong utilization. And as the holidays and the new year approach, more residents were able to check the status of their benefits to make sure that they can plan, budget, and support their families. Now, the next area we're going to talk about that Nava has identified will be covered by Brian Jones, who I'll hand off to now.
Oh, thanks, Joseph. So, hi, everyone. I'm Brian Jones. I'm working with Nava as a SNAP subject matter expert and bring more than 20 years of experience in SNAP operations and payment accuracy work. This includes some of the time that, as Director of Quality Control and Management Evaluation for the state of Kentucky, where I helped lead some initiatives focused on improving payment accuracy, which is the top of everybody's mind at this time. So, what's exciting about this work is that Nava, not only on the items that Joseph just touched on, is they're working on building a pre-QC tool. So some states call this quality assurance or program integrity, but this gives states a real opportunity to get ahead of errors instead of reacting after the fact through the QC process. So today we know that most early reviews are manual and time consuming, which makes it hard for staff to know, where their effort has the greatest impact. So this tool would change that. It uses data and rule-based checks to flag some of the common risk areas. So we know some of those are like income, shelter, household composition, deductions. So then it prioritizes those high-risk cases so that staff can focus on the work that will make the most impact on the error rate. So also to ensure this targeting is grounded more in evidence, Nava is also leveraging the SNAP error rate dashboard. This was developed with Georgetown University and the University of Michigan's Better Government Lab to identify which error types are actually driving those payment error rates. So the bottom line is that this approach helps states shift from a more reactive compliance to a proactive accuracy. So catching issues earlier, which is going to help tackle that error rate, using staff time more effectively, and then focusing improvement efforts where they'll have the greatest impact to address the payment error rate. So with that, I'll turn it back over to Joseph.
Thank you, Brian. So, I want to just take again an opportunity to say thank you for hearing about some of the work that we're doing within Snap. I also wanted to provide the link to our to Nava's Snap page where you can see all of the demos that we're seeing in this presentation. There is a voiceover that will walk you through it and some of the areas that we're working in. So, thank you for your time today, and I'll pass it back to Ed.